There's a crisis in A&E departments across the country. That's what the Royal College of Emergency Medicine has said. Rising cases of both flu and COVID are putting added pressure on the NHS, and the boss of the Royal College of Emergency Care says reports of 500 people a week dying due to delays in emergency care are, quotes, more than a guesstimate. And new research as well shows 1 in 4 people have bought medicine online or at a pharmacy to treat their illness themselves after failing to see a GP. We spoke to a GP earlier on. He was basically saying that there are a few issues at play there. Money for GPs. Part of the issue is as well that we are apparently not allowing many of our European GPs to actually come in at the same time as not training enough of our own. I can believe all of that. I find it absolutely stunning that we had a record year in the channel and we can allow all of those people in. But when it comes to, I don't know, a French doctor, apparently that's a lot more difficult, but there we go. Let's talk now to Matthew Lesh, who's the head of public policy at the Institute for Economic Affairs. Matthew, great to see you. Happy New Year, Merry Christmas,
all of that. Happy New Year.
Yeah, there you go. Right, OK, talk to me. How do we fix this particular crisis in the NHS? I'm sick of problems, Matthew. I want solutions. You're my man. Talk to me.
Well, geez, Patrick, if there was easy solutions to the NHS, I think they would have long since been seen. What we're seeing generally in the NHS is quite depressing. It's people waiting days to be admitted, people lying in corridors, people screaming, including children screaming in emergency rooms. It's confronting, it's worrying, but sadly, absolutely nothing new. Every winter, there is an NHS winter crisis. This is not normal. This is not universal. Not every country manages to have a healthcare system that struggles under strong pressure every single winter. And it speaks to a broader issue of the NHS, which is we put more and more money into the system. We've got record amount of funding, more doctors and nurses than a decade ago, something like 40% extra funding since 2010 in real terms after considering inflation. And yet right now the NHS is struggling in what is effectively efficiency, which is it's not doing as many operations, it's not seeing as many patients, it's not treating people for what's wrong with them. Now this does seem to speak to a fundamental problem in the NHS, which is it is a highly monopolistic, highly bureaucratic, one-size-fits-all system that's inevitably struggling under increased pressures and needs more structural reform.
Now, Matthew, whenever I get now a junior doctor or a nurse or someone on, I always ask them what they're paid, and then I'll say to them, do you know what a director of lived experience is paid, or a diversity manager, or one of that squishy middle ground of people who, let's be honest, are usually on between 100 and 150 grand a year. And I'll say to them, do you think they're really worth 3 or 4 or 5 times the amount of your salary? And I am staggered by the fact that they always refuse to answer that question. It's almost like they don't want to go after their own because they also work in the NHS. But actually, are those people the problem, not necessarily the government?
Yeah, look, I think there are fundamental managerial problems at the heart of the NHS. Obviously, there's people being hired for what many would consider fake jobs, not necessarily adding a substantial value in the NHS. At the same time, though, you have a lot of doctors and nurses who complain that, in fact, we've underspent on middle management, that they have to spend a lot of their time filling out paperwork rather than actually treating patients. So one of the issues, of course, is the government consistently says, well, we're putting more money into the front line, we're going to cut back middle management. The NHS proportionally actually has relatively few managers compared to private sector organisations or other healthcare systems. And so therefore, we've ended up leaving doctors and nurses doing bureaucratic nonsense rather than actually treating patients. I think that's one of a gazillion issues in the NHS, and it's structural and fundamental. It's hard to fix these efficiency problems when you have such a top-down system where the government will jump around with different priorities. And we're going to get another plan for the NHS shortly, and I'm sure it's going to have about as much success as the others because they're not actually reforming the underlying structures that have led the UK to have a worse healthcare system than Germany or France or many other Western European countries.
I find it amazing that this country, we locked down to protect the NHS. People lost their jobs to protect the NHS. People developed catastrophic mental health problems and actually became more ill themselves to protect the NHS. And now, get a load of this. Some chap in Wales is telling us to not go for a long run, because if you go for a longer run, it will increase the chances of you ending up needing an ambulance. I suppose it very much depends on where you're running or how you're running. But there are serious questions now about whether or not the British public have a duty to take extra precautions with their day-to-day life so as to not overburden the NHS. Now, obviously, I don't go base jumping as a matter of regularity. I don't bullfight and things like this. I don't do exceptionally dangerous things. But at the same time, I might like to go for a long run without having to think about our NHS. And I'm just wondering, is it time, Matthew, that we had a conversation as a country about whether or not we want to dedicate the vast majority of our public's expenditure into a health service. Is that what we need to have? Because we have to have a choice now, don't we? We either do that or we don't.
Yeah, look, Patrick, as someone who went for a bit of an extended run this morning, perhaps I should be feeling...
Absolutely shocking. Go on, carry on.
How dare I indeed try to take care of my own health? Quite bizarre. I mean, I find it quite disturbing, I think, in the same way that you're suggesting, which is a healthcare system exists to serve us. We don't exist to serve a healthcare system. And I understand people sacrificed, perhaps rightfully so, in terms of social contact during COVID, not to potentially give the disease to elderly people or to put not necessarily put the same burden on the system. But at the same time, we put so much money into this healthcare system. I think getting to the central point. I mean, there's no issue with a wealthy society as it's aging, as there's more burdens and more, in fact, more technology behind healthcare that the system can purchase to put more money into healthcare. I think that's a kind of a good social outcome that we want. There's no issue necessarily with funding healthcare. The question is about how we fund it. The UK is pretty unique in the fact that it's basically all it's taxpayer money goes to the NHS rather than having any kind of patient choice, patient control of that money. We have relatively little choice within the NHS about how we spend it. We discourage effectively from getting private healthcare because not only do you have to pay for the NHS, we also have to pay additional amounts for that private care. So the way the system is structured is completely wrong in terms of encouraging people to take responsibility or patient choice within the system because it's so monolithic.
That's it. Just sorry, I know you've got to go, but just very quickly, because you've hit on a key point right at the end there, which is about people taking responsibility. Now, at the moment, is it too easy for people who work in our NHS, management level I'm talking about here, who underperform or who are rubbish at their job, to blame it on the government? Because if that's the case, would privatising it actually give them nowhere to hide?
Yeah, I mean, this is a pretty classic behaviour in public sector organisations, which is it's very hard to fire anyone, very hard to deal with people who aren't performing up to their abilities and aren't necessarily delivering for the system. And inevitably that will encourage a culture of laziness and inefficiencies. I mean, everyone maligns profit, but profit is the outcome of getting efficiently delivering something to people. Yeah. It's the profit you receive on getting us that fruit and vegetables at the supermarket at a low cost. That is efficiency, and that's what the NHS is lacking. It doesn't have a price mechanism, it doesn't have the normal incentives for good outcomes, which we see in the private sector.